Hello friends, myself Dr. Akhilesh. In this video, I will discuss the MCQs on ionic compositions of ECF and ICF. This is one of the important topics for NEET, NEXT, INICET, FMGE, USMLE and various other entrance exams. So now discuss these questions on this topic. So the first question here, the first question is the most abundant ECF ion is. So in this question, you have to know what is the ionic composition of the ECF, and side by side you have to also know what is the ionic composition of the ICF also. So this ionic composition of the ECF, so in this, the ionic composition of ECF, you have to know what are the major cations. Cations means those ions which are having the positive charge, and what are the major anions of the ECF. So the major cations of the ECF, they are, one is the sodium ion and other one is the calcium ion. So out of these two, sodium and calcium, sodium concentration is more than the calcium concentration. So sodium will be the major cation out of sodium and calcium for the ECF. And regarding the major anions, anions are those ions which carry the negative charge. So these major anions, they are, one is the chloride anion and other one is the bicarbonate anion. So out of these two, chloride is the major anion of the ECF. And if we talk about the major ion, the major ion means it includes the both cations and anions. So if we talk about the major ion of the ECF, then this, out of this sodium, calcium, chloride and bicarbonate, out of these four, sodium concentration is in the highest amount. So the sodium will become the major ion of the ECF. And since sodium is the major ion of the ECF, so therefore the osmolality of the ECF, so the osmolality of the ECF is mainly due to, so osmolality of the ECF will be mainly due to this sodium ion because it is present in the highest concentration. Now regarding the ionic composition of the ICF, so we will compare the ionic composition of the ECF with the ICF. So ionic composition of the ICF. So here the major cations. So major cations of the ICF, they are, so one is the potassium ion and other is the magnesium ion. And out of these two, the potassium ion is more in concentration than the magnesium ion. And the major anions, so major anions of the ICF, they are, one is the phosphate anions and other are the intracellular proteins. So intracellular proteins which are present in the anionic form. So intracellular proteins, they are the anions of this ICF. So out of the phosphate and the proteins, so phosphate, they are in more concentration than the proteins. Now if we talk about the major ion of the ICF, so major ion of the ICF, then out of potassium, magnesium, phosphate and proteins, out of these four, the potassium is in highest concentration. So major ion of the ICF will be the potassium ion. So out of these four, potassium will be the major ion of the ICF. So therefore the intracellular osmolality or you can say that the osmolality of ICF. So intracellular osmolality is mainly due to, so it will be mainly due to which ion? So it will be mainly due to the potassium ion. Now one more thing also, that if we compare the ratio of the ECF to ICF calcium ion concentration. So the ratio of ECF to ICF calcium ion, so this ratio is equal to 12,000 is to 1. It means that if there is one calcium inside the cell, then there will be 12,000 calcium outside the cell. So this ratio is 12,000 is to 1. So let us recall this again. So for the ICF major cation is sodium, other one is the calcium. Out of these two, sodium is more in concentration, and the major anions of the ECF, so chloride and bicarbonate are there. So out of these two, chloride is more in concentration, and if we talk about the major ion of this ECF, so out of these four, sodium has the highest concentration, and therefore the osmolality of the ECF is mainly due to the sodium ion. And in the ICF, the ionic composition of the ICF, the major cations, they include, one is the potassium, other is the magnesium. Out of these two, potassium is more in concentration, and the major anions, so these are the phosphate and the protein anions. Out of these two, phosphate are more in concentration. So therefore the major ion of ICF is the potassium ion, and hence the intracellular osmolality or osmolality of the ICF is mainly due to the potassium ion. And the ratio of ECF to ICF calcium is 12,000 is to 1. So now let us go back to the question here. So question is, the most abundant ECF ion is. So answer will be the sodium ion. So sodium will be the most abundant ECF ion, and for the most abundant ICF ion, if in the question it is written as most abundant ICF ion, so for the ICF ion it will be the potassium ion. Right. Now let us look at another question. So another question is, the major cations of ICF are. So cations means the positive ions. So remember this, the major cations of the ICF. So they are, one is the potassium ion, other one is the magnesium ion, and out of these two, which one is more in concentration? Potassium. Similarly, the major anions of the ICF, they are, so major anions of ICF are, they are the phosphate anions and the protein anions. Out of these two, which was more in concentration? The phosphate. Similarly, if we talk about the ECF, so the major cations of the ECF, so major cations of the ECF, they are, one is the sodium, which is more in concentration than the calcium, and the major anions of the ECF. So major anions of ECF, they are, one is the chloride anion, which is more in concentration than the bicarbonate anion. So now the major cations, now come to the question here, the major cations of the ICF are. So major cations of the ICF are, so answer is the A, that is sodium. For the ICF, no, not A. So it will be the, because sodium is for the ECF, potassium is for the ICF, so A is not the answer here. Calcium again is for the ECF, and sodium is also for the ECF, so B is also not B is also not the option. So A is not the option, B is not the right option. Magnesium and potassium. Magnesium is for the ICF and potassium is also for the ICF. So this one is correct, C. The bicarbonate, this is for the ECF, and the potassium, this is for the ICF. So this is also not the correct answer here. So the correct answer for this question is the C, magnesium and the potassium. Now let us look at the another question here. So another question is the major cations of ECF and ICF are. So for the ECF and then ICF. So sodium is the major cation for the ECF and the potassium is the major cation for the ICF. So this is the correct one. Potassium is for the ICF, sodium is for the ECF. So this will be wrong here because in the question we have to say first ECF then ICF. So this is wrong. Calcium is for the ECF and potassium is for the ICF. So here the option C also appears to be correct, but remember, out of this calcium and sodium, which one will be the more in concentration? The sodium will be more in concentration. So if we have to select between option A and C, then option A is more correct here. Now about D. So D, this is the sodium is for the ECF and magnesium is for the ICF. Again here this appears to be correct, but remember, in the ICF the potassium concentration is more than the concentration of this magnesium. So if we have to select between A and D, so option A is more correct than the option D. So out of this A, B, C, D, so which one appears to be the more correct here? So option A is the more correct here. So answer here will be the A. That is the sodium and potassium respectively. Now let us look at the another sample question. Intracellular osmolarity is mainly due to. So this intracellular osmolarity will be mainly due to that ion which is present in the highest concentration. So mainly due to that ion. So due to that ion which is in the highest concentration. So which ion is in highest concentration inside the cell? So this will be the potassium ion. The sodium, so this sodium will be for the ECF. So the sodium is responsible for the extracellular. So it is for the extracellular osmolarity. It is for the extracellular osmolarity. So the sodium will be responsible for the ECF osmolarity, or also you can say that ECF osmolarity. So answer here is potassium for the intracellular. If the question it is the intracellular osmolarity, go for the potassium, and if it is the extracellular osmolarity, go for the sodium. And suppose if it is written as the plasma osmolarity is mainly due to. So plasma osmolarity is mainly due to. So then what answer you will mark here? So you know very well this plasma. So plasma is part of which one? So it is the part of the plasma is part of the ECF. So this plasma osmolarity is mainly due to which ion? It will be due to the sodium ion, because the sodium is the main ion of this the ECF or the plasma. So if the question is plasma osmolarity or osmolarity is mainly due to, so answer will be the sodium. So here in this question it was asked the intracellular osmolarity, so we will go for the potassium. Let us look at the another question here. The true statement regarding ECF as compared to ICF is. So ECF is rich in potassium. So this statement is wrong, because the potassium ion is mainly present in where? Mainly present in the ICF. ECF is more than the ICF. This is also wrong because the ICF is more than the ECF. This is because the ICF, this is equals to 40% of the body weight. So ICF is 40% of the body weight and the ECF is 20% of the body weight. So out of this ECF and ICF, ICF is more than the ECF. So option B is also wrong. ECF is rich in organic anions. This is also wrong because the organic anions or this protein anions they are mainly in the ICF. This I have discussed in the previous questions that the major anions of the ICF are the phosphate and the protein anions. So these organic anions will be more in the ICF. So this is also wrong. Option D, high sodium to potassium ratio is seen. This is true because the sodium is present mainly in the ECF. So this is the right answer. So high sodium is to potassium ratio is seen in the ECF. So answer D here, answer is the D answer here. Now let us look at another question here. So another question is false about. We have to find out the false about body fluids is. We have to find out the false statement. Look at the first statement. Bicarbonate is mainly present in the ECF. So this is the true statement. Sodium is mainly present in the ECF. This is also true statement. Potassium is mainly present in the ICF. This is wrong statement because potassium is mainly present in the ICF. So calcium is mainly present in the ECF. This is also true statement. So out of these four, which one is the false statement? So C is the false statement. So answer here is the potassium is mainly present in the ECF. Let us look at another question. The ratio of calcium concentration between ECF and ICF is. So as I discussed in the previous question, so this ratio of the ECF to ICF calcium ion is, this ratio is 12,000 is to 1. So the answer here will be B, 12,000 is to 1. Now let us look at another question. The another question is which of the following causes entry of potassium into the cells? So now this is a slightly different question from the previous question. Here we have to say which of the following will cause entry of potassium into the cell. So entry of potassium into the cell means the potassium will move from the ECF to the ICF. So we have to tell what are the factors which will lead to entry of potassium from ECF to the ICF. And remember one thing, when the potassium will move from ECF to ICF, then what will happen to the ECF potassium level? So here the ECF potassium level will decrease and this will lead to rise in the ICF potassium level. And one more thing you have to remember from this type of question, that which causes the movement of potassium from inside the cell to the outside the cell. So which will cause the movement of potassium from inside the cell to outside the cell, and this will lead to what? So this will lead to rise in the ECF potassium and decrease in the ECF potassium. So we will discuss these two things here. So let us see here that the factors that shift potassium into the cells means those factors which will shift the potassium into the cell means from ECF to the ICF, and these factors they will decrease the ECF potassium. So what are these factors? So remember here, number one, it is the insulin. So remember this is very frequently asked in the exam about this insulin. So insulin will lead to movement of potassium into the cell. So therefore this insulin, it will lead to decrease in the ECF potassium. Insulin will lead to decrease in the ECF potassium. So there is chances that this insulin can cause hypokalemia. The other hormone is the aldosterone, and the excess of the aldosterone, which is called as Conn syndrome. So Conn syndrome will also lead to this decrease in the ECF potassium or hypokalemia. The third one is the beta 2 adrenergic stimulation. Fourth one is alkalosis, and the fifth one is hypoosmolality. So these are the five factors which will shift the potassium into the cell, leading to decrease in the ECF potassium. So you can remember all these five factors by one mnemonic here. What is the mnemonic here? The mnemonic is all bad persons in home. All. So in this all, AL for alkalosis, B for beta 2, ALD for aldosterone, in for insulin, home HO, H included in the hypo, and O for the osmolality. So remember this IN for insulin, and this insulin will lead to what? Shift potassium in cell. Remember this. So insulin will shift potassium in the cell, leading to decrease in the ECF potassium. So these are the factors which will, these are the five factors which will shift the potassium into this into a cell, and they will decrease the ECF. Now look at this one. The factors that shift potassium out of the cells, which will increase the ECF potassium, means just opposite the previous one. So here the potassium will come out of the cell. This will lead to increase in the ECF potassium. So what are these factors? So these factors are almost just opposite to the previous one. So here insulin deficiency. So first is the insulin deficiency. Just compare from the previous one. Insulin will shift potassium into the cell, and insulin deficiency, it will shift the potassium out of the cell. So this will lead to increase in the ECF potassium. Other one is aldosterone deficiency, which is also called as the Addison disease. Addison disease is the primary hypoaldosteronism. So Addison disease, where there is aldosterone deficiency, it is the second factor which will lead to increase in the ECF potassium. Then the third one is beta adrenergic blockade. So if you block this beta adrenergic, it will shift the potassium out of the cell. Acidosis. So acidosis is the fourth factor which will shift the potassium out of the cell. Then the cell lysis and the tissue destruction here, so they will also shift the potassium out of the cell. Strenuous exercise, then the hyperosmolality. So external exercise is the sixth factor, hyperosmolality seventh factor, digitalis. They all will shift the potassium from inside the cell to the outside cell, and they will increase the ECF potassium. So you can see here the insulin here and insulin deficiency here, aldosterone here and aldosterone deficiency on the other side, beta adrenergic stimulation here, and on this side the beta adrenergic blockade, here alkalosis, and here the opposite of the alkalosis, acidosis, then here hyperosmolality, and this side is the hypoosmolality. So these are the various factors that shift potassium inside the cell and shift potassium out of the cell. So now let us come back to the question here. The question is, which of the following causes entry of potassium into the cell? So entry of potassium into the cell, it will be which one? Insulin. Another is which one? So aldosterone, right? Then which receptor? Beta 2 adrenergic receptor stimulation. Then which one? The alkalosis. Then which one? The hypoosmolality. So insulin, aldosterone, beta adrenergic stimulation. The fourth one is alkalosis, and the fifth one is hypoosmolality. So all these factors will shift the potassium into the cell. So here option matching is the insulin. Addison disease, which is due to this aldosterone deficiency, acidosis, and the hyperosmolality. So these three factors, what they will do? So these three factors, they will shift potassium out of the cell. So they will shift the potassium out of the cell. So insulin will shift the potassium inside the cell. So in this question, the correct answer is the A, because it is asking which of the following causes entry of potassium into the cell. You can also go through the similar questions on one of the page on the Facebook. The page name is Physiology MCQ on the Facebook, where you can find more questions on the physiology which are important from various entrance exam. And you can also uh, go through this book, the Conceptual Physiology Review, where the important questions on this physiology for various entrance exams are mentioned. And you can buy this Conceptual Physiology Review book from the Amazon. It is available at the Amazon at very low price. So thank you for watching this video, and you can send your comments on this mobile number 7063956 243. If you are from India, then you can just uh, send your feedback on this WhatsApp number 7063956 243. And if you are outside India, then you have to put this code before this number +91. So thank you once again for watching this video.